Welcome to Positive Parenting. I'm Deanne Conrad, Community Relations Supervisor for the Sioux Falls School District. We thank you for joining us on this Positive Parenting, which is a joint venture between the education experts from our public schools and the medical and child development professionals of Sanford Health. We are going to be talking about the flu season today. Like it or not, the flu season is upon us. So in the next half hour, we'll be talking about some preventative measures such as the flu shot, signs and symptoms that you might see in your own children or yourselves, and when your child might be too sick to go to school. Before we get started though, I'll have our guests introduce themselves and then we'll take off.
I am Molly Satter. I'm the Health Services Supervisor for the Sioux Falls School District.
Hi, I'm Dr. Wallace Fritz. I'm a family medicine doctor at Sanford 69th and Minnesota Clinic.
Well, we thank you both for being here today. Dr. Fritz, are we seeing flu in the city of Sioux Falls in this area just yet?
There have been a couple of cases that I've heard about, but it's not been the overwhelming sickness that we've seen quite yet, but we anticipate it coming.
Okay, and it seems like the flu or any illnesses, they don't seem to be isolated to those winter months that it used to be. We've had some pretty nice weather here lately, and still there are some of those cases out there. So I think it's one of those situations that used to be when we were just confined to our homes in the winter months, but that's not the case either. How are students doing health-wise in terms of what you're seeing in the schools, Mom?
In the schools, we're really not seeing any major outbreaks of any type. Kids seem to be very healthy. As with last year, it was a really mild season, and so this year has started off great. No major outbreaks that we've heard of or seen.
We see that, but there are people actually tracking too how much flu we have. The state does some tracking. The CDC does some tracking. Have you heard what the forecast is, so to speak, for flu this year?
Influenza is very unpredictable in terms of tracking, and while we do our best and we've got these government agencies that are doing it, we can't ever know exactly when it's going to come and how bad it's going to be.
Okay, so there were, we know from the H1N1 scare several years ago that there are varieties of strains. Do we know anything about the strains that are coming this year?
Again, they're forecasting it, and a lot of times they look at other countries that have opposite climate as us and try to predict a little bit as to what strains are going to be available. But as of yet, at least I haven't heard of anything that is coming absolutely.
Sure. Well, it's one of those things that's kind of a wide open, and when it gets here, we'll know, right?
Absolutely.
That's one of the things. So there are obviously many things you can do to prevent the flu. Most obvious would be probably the flu shot or the nasal mist. Talk to us a little bit about the benefits of one over the other, or what you see in your practice.
Well, both of them are very effective in helping people avoid the flu as best as possible. The injection is actually a killed virus, where it's injected, and it gives our body just a little bit of taste of what the influenza bug is going to do, and sort of gives them a warning of what's going to happen, and so that if they're inoculated with influenza, that the body can help to fight against it.
Okay, so it's a wake-up call to the body, kind of.
Absolutely.
Okay.
Yep.
Okay. If we think about it that way, it's more than just that ow with the poke of the needle. Is one better for? Is the nasal mist, the vaccine, better for kids? Does it just depend?
Well, I don't think that it's necessarily more effective. Some would say that it maybe is, because it is a live virus that is sprayed into the nose. The benefit obviously is not having the shot, and sometimes little kids that are screaming and kicking come in may benefit from the nose, although some kids don't like that either.
Right.
Most of the time, both are very well tolerated, but as far as efficacy, one isn't necessarily better than the other. Both are effective in the flu vaccine.
My children have been the kicking and screaming ones when we talk about shots, so we have gone with the nasal mist.
Yeah, I almost think that it's worth thinking about for the kids anyway. They
Certainly.
kick and scream, and then it's done, and they're like, oh, well, that was it?
Yeah, it's all over. So we also in the schools do some flu shots, make some flu shots available for students and staff.
That's correct.
And Molly, we've been doing that for the past couple of years.
Several years. Yep, several years back, and we will do that again this year. And we provide the flu vaccine for middle and high school students, and then for staff. Well, we recommend elementary or the younger students go to their family physician for that shot, just because there's a little bit different schedule. Some may require 2 flu vaccines, and it just becomes very difficult for us to track that, and that's best provided through their family physician.
Right. Certainly, it's not that we wouldn't do it if we had the information, but in terms of sometimes there's 2 shots needed, and just that.
And their physician knows them best and what they have had in the past and what that would mean that they would need this year, because it's all based on that. Am I correct?
Yeah.
Their schedules.
We're in a school setting, so you're relatively close to people. The big sneeze, the cough, the whatever, that's how flu transmits, correct?
Yeah.
So those close quarters can, while it's good for learning, or the environment is good for learning, sometimes it's
not conducive to staying healthy always, just when you're that close to each other.
Right. And we do this service also for staff members.
We do
too.
Yes. And for staff members, the cost is free if you have district insurance, and if you do not, it's $10. So, which is a very reasonable cost.
Right.
So
and so there are obviously that must take some pressure off of the clinics and such, because sometimes it does become difficult to get an appointment or something like that, especially if we're in a heightened season where there are many people that are ill or what have you. But
well, and I think in most clinics you don't necessarily need to see the doctor. It's just making an appointment to get an injection. And during flu season, I think most of the clinics have extra staff available or a nurse, someone dedicated to giving the flu shot.
And I know my clinic also has particular days where it's like the flu shot days, and sometimes even a Saturday set up so that families can come in and maybe want to bring everybody in, then go for ice cream after or something.
Right. And certainly if you're there, even for another reason, the flu shot is available, and we have started giving it here already.
I did want to talk about that, because there always seems to be that question of how long, if you get a flu shot, how long will it protect you? And what's the right answer to that? Do you get it early? Do you wait?
I think that it used to be sort of something that we said, oh, let's wait until November, December, until we're in heightened flu season. But that's been disproven in that it does provide for the long term.
So there shouldn't be a need, if you went out and got your flu shot early in October, there shouldn't be a need in March to get another.
Nope, I would recommend taking advantage of that or seeing your physician and getting the vaccination.
Right, good. So do the schools do any of the nasal mist?
We do not. We receive the vaccine from the state, and so it is the injectable flu vaccine and not the nasal spray.
And so how does that work? Do we have all school nurses that are doing it, or how are we handling that influx of kids on those dates?
Well, we utilize our school nurses, absolutely, and then we also partner with some of the nursing programs. USD and the Augustana nursing programs have been very generous in offering their students to come help with that. So it's kind of a win-win situation. They get the experience, and then we get the help. So,
wonderful.
And then we have volunteer nurses that also like to come in and help out. So
awesome. Well, that's a great service, certainly. There's always that discussion about when we say the flu, our brains like to think of it being the stomach flu, which, it's really, the flu is the respiratory flu. What are the signs and symptoms of the respiratory flu, things that we should watch for? I know in our family we're allergy sufferers. So a lot of times, we're coughing at different things. Okay, then you have the hard freeze, and you might still be coughing. But how do you know that, what are the signs and symptoms, I guess, that would tell you might need to get in and be checked?
Well, that is a good question, and it's often a misnomer. The stomach flu actually has nothing to do with influenza, and that's kind of the nausea and the diarrhea. We use it even in healthcare. We call it the stomach flu because that's what patients know, but that's more of a gastroenteritis. Influenza is characterized by the abrupt onset of fever. In fact, it's interesting, some patients can say, I know that at 2:30 on Tuesday afternoon, I developed a fever, and it tends to be a high fever, 101, 102. It's by body aches, muscle aches. They just don't feel right. Things to look for in your children is a normally rambunctious and high energy kid is all of a sudden just laying down and going to bed even without being told
Prompted.
to do so.
That is rare.
Yeah, exactly. But it's sort of when you know that they're sick and they look sick. I think that's kind of some of the thing with the flu. You can get runny nose just like allergy season. You can get head congestion just like allergy season, but it tends to be a little bit worse. And the abrupt onset is also another kind of tall tale sign that this might be influenza.
So what is the test for influenza?
There is a rapid a rapid test that has been developed. It takes about 10 minutes, and it looks at respiratory secretions. So what your doctor will do is spray a little in your nose, in the child's nose or your nose, and pull out a little bit of the respiratory secretions. And then they can run a test, and it takes just about 10 minutes is all to know if it's influenza.
So then, if it is influenza, how do we treat? What do we do?
Well, a lot of it is symptomatic care, unfortunately. If you catch it within the first 48 hours, there are some medications that don't take care of the flu completely or get rid of it, but it can decrease the amount of time that you're sick, and it can also improve the severity of the symptoms. So it's a little more easier course. Those are not indicated after 48 hours. So if you suspect that you might have the flu, it's probably important to go see your doctor so you can get started on those.
I'm always kind of the thought that, oh, I'll wait till tomorrow, see if I feel any better tomorrow. But when, like you said, when you do have that rapid onset, perhaps that's the key symptom that should get you to the doctor.
Right. I think we don't necessarily test everybody. I think early on we do, so we doctors can kind of sharpen our pencils and get our clinical acumen going. But you get to the point, and I'm sure, Molly, you've seen this too in the school. Yep, this is influenza. You can walk in and pretty quickly know, based on how the child is looking and with a few quick physical exam components, you can tell. So sometimes we presume it and treat accordingly.
And we do have, thankfully, we have a couple of schools that have medical centers or health
School-based
offices,
health clinics.
school-based health clinics in the facilities. So that's a quick way too for a student to be identified also.
We're very fortunate. We have school-based health clinics at Hawthorne Elementary, Terry Redland Elementary, soon to be Hayward Elementary, Joe Foss High School, and Washington High School, and Whittier Middle School. So those are all the places that we have those clinics, and we partner with Avera and Falls Community Health on those. And so the school nurse can see the student. If they suspect anything that that it needs to be moved on further to the clinic, then they refer them down to the clinic, and the student can be seen right there that day.
So that's a great way, sort of a fast track, so that you don't have to get your student out of school and then try to make an appointment and that kind of thing.
Yeah. It's very nice for families. It's very convenient, so it's a nice service.
Well, in terms of the flu and where we're headed, those, like we talked about, being kind of a breeding ground in a school for this type of thing, but what are some of the prevention efforts that our staff are doing to make sure that we have students who know what to do during the cold and flu season?
Well, the old adage, hand washing is everything. I mean, that just really is very true, and we continue to remind students to wash their hands. We have hand sanitizer available throughout the schools, and encourage students to use those and staff to use those. The school nurses go in and can talk to classes about if they're having certain outbreaks or kids are really sick. They can go in and do some of the hand washing teaching, and so really just the basic types of things that you know your mom always told you that it keeps you healthy. So
Right.
yeah,
Sneezing in
your
the
arm,
elbow.
That's right.
Right.
Sneezing and coughing in your elbow, and
I was buying some Kleenexes for my allergy-suffering family the other day, and I noticed they have this sneeze shield or something. These Kleenex, these sneeze shields. I'm like, okay, what next? Isn't that what a Kleenex is supposed to be? A sneeze shield? So they were finding a new way to market, apparently. So, but that is important. That prevention, that simple hand washing.
Simple hand washing, and I like that coughing in here rather than the hand, because we don't shake with the anti-cubital faucet, if you will.
Say that again?
I know. Nerded up. I think the other thing that is important is if you are sick, it's important to stay home and not try to risk it. Even if you're wrong, a day missed is better than having the whole school out.
Sure. And
we have some general guidelines that we encourage families to follow. And if a student has a fever greater than 100, we ask that they not be in school and that they not return until that fever is gone without fever-reducing medication, meaning don't give them Tylenol or ibuprofen and send them out the door. We really want them feeling better before they come back to school. Anytime if there's nausea or vomiting and diarrhea, they would need to be out of school, or undiagnosed rashes, we would ask that they stay home. So those are some of the basic guidelines.
Plus, if they have those symptoms, they're probably not going to be
They're not going to
ready
get a
to
whole
learn.
lot out of the school day if they have influenza and they're really feeling cruddy. So they might as well be at home getting rest and getting better.
How important is rest and a healthy diet and exercise? Does that play a part in prevention efforts, or is it just a good idea anytime?
Absolutely. Sleep is so important, and there are always studies that are coming out that show how important sleep is. When years ago it was just like, well, you're more crabby if you don't get enough sleep. But we also know that there are health benefits to that in terms of boosting immune system and keeping an overall health. So all those things are very important. Eating the right foods, getting enough rest, getting enough exercise, those are all important in prevention. A healthier body is better able to fight disease.
Right. What about those other sort of marketed products out there that, you can reduce your cold if you take zinc, or if, these other supplements and things? Do they help? Is it worth it?
I think anecdotally, people will come into my office every day and swear by vitamin C or zinc, and there is some literature out there, but one of the things that it is important to beware is that they're not marketed under the health foods, and zincs and some of the over-the-counters aren't under the same strict they don't have the strictest standards as some of the medications that have to prove absolutely that this helps this. And so they're able to make more claims. I always think the buyer beware. If it sounds too good to be true, it probably is.
Yeah.
But some of those things are normal things we find in good foods and healthy foods that can help keep us. So I don't know that they're necessary or will necessarily prevent. But most of the time, in doses that are appropriate, they probably aren't going to hurt you. And if they have a chance of helping, it might be worth it.
Right. And eating an orange for some vitamin C, or whatever the case, whatever it might be, drinking milk for vitamin D or whatever, that's not bad for you anyway. That's a good thing for you anyway.
Right.
So if you want to do that and you think it might help, it's probably not going to hurt anymore either. So.
And in the school, if we get questions like that from parents all the time, would it be good to use this, or should we try this? And we always just refer them to their physician. It's just always a conversation that they should have with their physician. Some of those over-the-counter or herbal things can interact with other medications, and so we always just want to make sure that their physician knows what they're taking. And
Right. You brought up a point too, and we do have some rules if you have medication where students need to come to school and have medication during the day. Do you just want to briefly review that?
We revised our medication administration policy this last summer, and so we do have some kind of new guidelines regarding that. We need to have the proper paperwork filled out for them to have medication at school if we are going to be administering that, or if students are going to be self-administering that. Now in grades early childhood through 5th grade, students can only have medication that's administered by staff. We don't want them walking around with medication in their pockets at that young of an age. In 6th grades through 12th grade, then students can either have the medication administered at school, or they can self-administer the medication with the proper forms on file.
Okay.
And so we would just encourage families to check with their physician, or not their physician, but with the school regarding what the proper
rules.
form is and
Right.
what the rules are.
Okay.
So,
And that's important not only for the health and safety of that child, but for the health and safety of
other students,
Other
as,
students
well.
as well.
Yes, it just creates a safe environment for all students. So.
right. Good to have those guidelines in place
It
so that
is.
we don't have any issues along the way.
Yes.
Is there anything further that you want to discuss about the flu? Anything else that we haven't talked about that people really need to know about as we come upon the flu season?
I think one of the things that I hear a lot, and if you're kind of on the fence about whether or not to get a flu shot, is there's a myth out there that, oh, I got the flu from the flu shot. And that is false. As I mentioned, the injection is a killed vaccine, and so a killed vaccine can't cause the flu. And even the nasal, even though that is a live vaccine, the parts that cause infection of influenza are removed from there, so that's not true. The biggest side effect, or what people will complain about, is a little bit of pain and tenderness where they get the shot, and they may develop a little bit of a low-grade fever, and that's actually just a sign that your immune system is recognizing that it's going in there. The other thing is, because of the time of year, and while we haven't seen a whole lot of influenza, there are a lot of colds, a lot of coughs, a lot of environmental allergies like at your house. And those things are often confused and can be difficult to ascertain whether or not this is influenza. So I think that dispelling that myth is important for everybody.
You do hear
understand.
that from time to time. Even I have taken the opportunity to have the flu shot for, gosh, as long as I can remember, as an adult even. And then, I'll encourage other staff or whatever, hey, they're giving flu shots. Oh, no, I don't get the flu shot because I always get the flu from the flu shot. And so it's important to be proactive and say to those people, oh, no, it doesn't work. So I appreciate your explanation of that and encouragement that people maybe need to know that we're not getting the flu from the flu shot. So anything else that you'd like to add in terms of what students, parents need to know regarding the flu to keep their students safe?
Just strongly encourage them to get the flu shot. It not only helps their student, but there's kind of the herd effect, they call it, where then the more people that are vaccinated, then the less likely it's going to spread. And so you're just keeping your family members, people around you healthy, as well as keeping that student healthy. And I strongly encourage that. So.
Right. And one final thing also, I think it really became a couple of years ago when we had the H1N1 scare, it really became awareness. There became a lot more awareness of the necessity of a flu shot and that kind of thing. So while that was kind of a scary time for a lot of people, it probably did some good in encouraging people to get flu shots as well.
I think you're right, and the recommendations are for everybody to get a flu shot, but especially if you have other disease or if you're in an extreme of age, either young children or older people, or those with chronic diseases like diabetes, asthma. The flu can be a little bit more severe in those patients just because of the detrimental effects. So,
and unfortunately, we do hear of people who succumb to the flu,
absolutely
dying, during the year as well. If they have those, a lot of times those more chronic illnesses can be amplified because of the flu symptoms. So, well, I thank you both for being here today. I think it's important that all of us are knowledgeable about the flu and the trouble it can cause. Do take preparations to get your flu shot and get your students in to be vaccinated on those days when we have middle school shots and high school shots available. And take your young children, your elementary age children, to their family medicine provider. Thank you for joining us today on Positive Parenting.